There are two types of stroke. An ischemic stroke is a sudden blockage in an artery, interrupting blood flow to the brain. This is the most common type of stroke. A hemorrhagic stroke is the rupture of a blood vessel in or around the brain. This is often life-threatening.
Treatment for an ischemic stroke focuses on dissolving or surgically removing the clot that is blocking blood flow. This can include medication called TPA, which can only be administered intravenously in the emergency department within the first 4.5 hours of symptoms, or mechanical thrombectomy, which is a surgical procedure to remove the clot. It's an invasive emergency procedure that we do in the neurocath lab.
The two main brain blood vessel diseases that cause sudden brain hemorrhage, often without warning, are ruptured AVMs, or clusters of abnormal blood vessels, and ruptured brain aneurysms, which are weak-walled, brain artery, balloon-like sacs. Treatment for a bleeding stroke depends on the cause, severity, and location of the bleed. A ruptured brain aneurysm can be treated surgically with open brain surgery, which is called clipping, or minimally invasive coiling methods. Dr. Thomas can do both and has decades of experience doing so.
Both hemorrhagic and ischemic strokes are amenable to specialized neurosurgical techniques and technology, some of which has only been developed within the last decade. This kind of brain surgery can be performed either directly under an operating microscope or indirectly through a tiny incision in the patient's leg without ever opening the skull. This state-of-the-art brain surgery is available only at advanced medical centers like Washington Hospital.
With Dr. Thomas and me, Washington Hospital is the right center of excellence to treat ruptured brain aneurysms and AVMs.
We have a full array of neurointerventional and open microsurgical techniques, and at Washington Hospital we use what is necessary for the best outcomes for our patients. We use whatever tool we need to keep our patients safe.
There are very few places in the world where a patient with an acute brain hemorrhage from an aneurysm or AVM rupture can receive the rapid and personal attention of a skilled neurosurgeon who knows both the most recent, minimally invasive techniques and also all the open neurosurgical techniques. And we work with the patient's primary care physicians to ensure the best follow-up care. Washington Hospital is an award-winning, certified primary stroke center. We hope that you never have a stroke, but if you do, we're here to help. For more information on Washington Hospital's stroke program, visit WHHS.com/stroke.